Mr. Issa has extensive experience in the management of international and local organizations. Somebody needs to tell Diamond that. Okay, and he has served as a board member and chair of several organizations in various countries globally. Effective September 1, Your Excellency, that was 2013, he was appointed as board chair of Amref Health, Africa's international board. Mr. Issa is currently the President's advisor and chief executive of the Presidential Delivery Unit in Tanzania. So when I say he is a true international rock star out of Tanzania, and he's a true global export out of Tanzania, I mean it. Put your hands together for my brother from Tanzania, the chair of the Amref Health Africa International Board, Omari Issa.
I challenged Caroline to a dance and she declined. Thank you so much, Caroline, for that introduction. Good afternoon, everybody. As Githinji said, I've been here throughout. I was, in the backseat most of the time, trying to see what was happening, listening very attentively to everybody. I wanted to get the temperature, and I think I can agree with Caroline that it's been a great conference. Your Excellency, Mrs. Toyin Saraki, the founder of the Wellbeing Foundation in Nigeria, Dr. Bernard Muya, who is the County Executive Council member of Nairobi County, representing Dr. Evans Kidero, Dr. Nicholas Muraguri, the Principal Secretary in the Ministry of Health, Kenya, Dr. Githinji Gitahi, I don't need to say what his position is. Ladies and gentlemen, it gives me great pleasure to address you at this closing ceremony of the Africa Health Agenda International Conference, or as Caroline says, AHAIC 2017. As chairman of the International Board, I am filled both with great pride at the success of the conference, but also with great humility because of your presence here and your participation in the event. Congratulations to you, Dr. Githinji, and your team for putting this all together. Asante sana. I want to begin by bringing to you the sincere apologies of His Excellency, Dr. Jakaya Kikwete, the former president of Tanzania, who had confirmed his participation at this event, but was unable to come at the very last moment because of bereavement in his family. The deceased was buried in Bagamoyo yesterday afternoon. She was 91 years old. Dr. Kikwete had committed to attend this conference as early as July of last year. He has been following the preparations of the conference very closely, the last time being Wednesday of last week when I was in his office, when he confirmed he would come and when we discussed the program and what he was going to say. He's been extremely supportive. The issues we've been discussing here are very close to his heart. And for those who are not aware, he's setting up a foundation which will focus on 3 areas, one of which will be health. He is going to be a great advocate of health in Africa. I therefore would like to convey my deep condolences and the condolences of the delegates at this conference to Dr. Kikwete and his family for the loss of their family member. The zeal that characterized the discussion in this hall over the past 5 days was encouraging and uplifting. It represents the bold vision that we all have set for the continent, and it filled us with hope that we can have an Africa that is healthy and prosperous. But we all know that this will not materialize into tangible benefits for the 1.2 billion people if we do not back our resolution by action. And I echo what Gethinji was saying in the communique. We urge all the key players to take action, not just to pass resolutions, but to follow them through with action. The ability of the AHAIC 2017 conference to reshape the conversation about healthcare in Africa depends to a great extent on our willingness to translate talk into action. Again, Gethinji referred that. So I will skip most of what I was going to say because I would be repeating what the communique has just said. Ladies and gentlemen, one thing that has clearly emerged during this conference is that the conversation about the Sustainable Development Goals and Africa's health agenda should not be reserved for technocrats and policymakers. Rather, it should be broadened to all sectors, including communities at grassroots. Issues such as access to clean water, poor sanitation, famine, poor health infrastructure, and gender inequality affect the communities at the grassroots more than anybody else. Equally important, it should include the youth, who have demonstrated in this conference that they are not just recipients of healthcare, but that they need to be actively engaged and consulted as a key player in shaping health and healthcare on the continent. Congratulations and best wishes. Amref Health Africa has been closely engaged with African communities for the past 6 decades. In fact, we're now celebrating our 60th anniversary. As the only international health NGO with headquarters in Africa, we have strong, authentic linkages with communities that give us an advantage in understanding the issues and working with them for change. We have learned through the decades that the long-term success of any health initiative depends on community support and ownership. Ladies and gentlemen, one of the most important outcomes we've had this week was the launch of the Workers, Not Volunteers campaign. I believe that this campaign and the toolkit that has been produced on how to implement it marked a turning point for health on this continent. If we are to achieve universal health coverage, community health workers will be a critical part of getting us there. But we must invest in research to know what has worked and what has not, so that we can build on our successes and avoid repeating mistakes. We also need to go back to our communities and do an honest audit of cultural practices which contribute to poor health outcomes. Some of the challenges facing Africa's healthcare system stem from issues outside the general scope of health, such as culture. Some of these issues are well known, but there are others that are not widely spoken about, yet which must be addressed if we are to move forward together. We must look at ourselves critically and begin to rewrite our story with sustainable health change as our goal. One story that we must rewrite is that of cultural stereotypes about women and their value in society. In this modern 21st century, many communities still consider women second class. Because the man holds economic power in the home, the woman cannot access health care without his permission. And so she and her children are at his mercy. This is a major reason for the high maternal and child mortality rates that we are witnessing in Africa today. We must write this story so that human life is valued over gender. At a personal level, I'm involved in an initiative with the United Nations on education in Africa. And I am actually, I say I'm honored, I'm delighted to be working with a team that is exclusively youth and women. That's my team. And they were selected not because they were young, they were not selected because they were women. They were selected because they were capable. Another story that we must rewrite is the involvement of youth in decision-making process. At 65%, they actually are the majority of people on the continent and must of necessity be involved in decision-making, including participation in the implementation commitments. We must ensure that they have easy access to information, that they can access youth-friendly health services whenever they need them, and that they are actively involved in designing health programs. Thirdly, we must rewrite the partnership story. We cannot achieve universal health coverage as individuals. We must do it together. We must put our egos and self-serving policies and bureaucracies aside and seek collaboration across all sectors and across all demographics. A partnership approach to health development should be marked by respect for each partner's expertise and a common overall goal to achieve universal health coverage. I want to single out public-private partnership, or PPPs, which have been discussed during the conference. We have heard all the issues that surround PPPs. But there are two areas that, based on my personal experience across the continent, that I would like us to do more work on. One, when we talk about public-private partnership, we only look at the government and we look at the private sector. But we forget the third part, which is the largest. It's the citizens. Now, these transactions take place without any communication to the citizens. The expectations of the citizens are totally different from the two partners who are negotiating at the table. So when the deal goes through and the health facility is set up, the people who were involved in the negotiations understand exactly what is going to happen at that facility. But those who are the beneficiaries have no clue whatsoever. So a year or 2 years later, you begin to hear complaints from the largest part of that community. So I urge all those who are considering and those who will be entering into PPPs to please ensure that there is effective communication throughout the process so that the beneficiaries understand what is going to happen. The second area, we must enhance the negotiating skills, especially of government officials. We heard from one panelist who said that usually you have one party that comes fully prepared and the other party is not. And in my personal experience, again, over several years, more than 20 years across the continent, I can name probably 2 or 3 African countries where I have not been to. The rest I have been in a working capacity. Usually when you walk into a room and negotiations are going on, the government representatives, probably 90% of them are lawyers. The issues we have around PPPs are not necessarily legal. 90% of them are commercial. But the commercial people are not on the negotiating table, except those from the private sector. I don't know how many of you have watched the movie Pretty Woman. Okay? It's a very interesting movie. If you have not watched, please go and watch it. One lesson from that movie: at the end of the movie, there is a major transaction. Major transaction. We're talking hundreds of millions of dollars. The principals enter into the room, and the lawyers open the room, the doors to go into the room. The principal said, no, you stay out. And the lawyers were very frustrated. They said, look, you are going to, something is going to happen, etc., etc. The principal said no. They locked the doors. They agreed, after which they called the lawyers and told the lawyers, this is what we've agreed upon, now translate it into legal terms. That's what needs to happen. But what happens with most governments is they have lawyers up front, and the commercial guys, and let me give you my personal experience. We're negotiating a contract in one country, and I went with a financial analyst, and there were 15 people in the room. 6 of them were lawyers. And they asked me for my lawyer. I said, no, the lawyer will come after we have agreed. Once we have agreed, then the lawyers will come. But now, we have nothing that we have agreed upon, so why do we need the lawyers? So we need to really enhance the skills, the negotiating skills, especially the commercial aspects. I can go on this because I'm very passionate about PPPs. I think it's perhaps the best opportunity for the continent to advance delivery of healthcare systems. If we develop PPPs in the right manner, we will solve most of the healthcare problems we have. So as we go back to our countries, organizations, and communities, let us all commit to rewrite the stories that hold back Africa's health. Let us look critically and objectively at ourselves and define our health agenda based on what we find and what we need. Let us commit to work together on this journey towards sustainable